I went to the doctors and I was referred to a CT scan. I received an appointment letter, information sheet and the safety questionnaire in the post a few days later. The clothes that I needed to wear for my appointment were basically clothes that I didn't have any wire in them or any metal. On the safety questionnaire, which I had to complete, there were questions regarding whether I had asthma, they wanted to know my weight, they wanted to know my allergies, they wanted to know whether I'd had a scan before, which apparently is quite critical information.
The safety questionnaire is very important. We like to know if you're allergic to anything, if you have diabetes or heart problems, and if your kidneys are working correctly. And when you bring that form with you, we will go through it with you and check that you are safe to have the contrast dye.
The preparation that I needed for my scan was all stated in the information sheet. I needed to fast for 3 hours before my appointment and drink lots of water.
We prefer patients not to eat anything before their scan because the injection of the contrast dye can give you a metallic taste in your mouth and occasionally you can feel nauseous from this. Diabetic patients can take all their usual medication, but if they would prefer to bring some food in with them which they can eat after the scan, that's absolutely fine.
There were instructions in the letter on where to go, so I came straight to the X-ray department. I was greeted by the receptionist at the front desk. They informed me would I like to use the self-checking machine. I did have problems using it, but the receptionist came out and showed me what to do. I was able to check in and follow the arrows round to the waiting area.
So when you arrive at reception, you will be asked to do the self-check-in. You are then asked to follow the arrows round to the CT waiting area. While you're in the waiting area, you can drink 2 cups of water, and then the radiographer will come and get you when you're at your appointment time. We will take you down into the scan room and we will just check your identification before we scan you. We will then look through your questionnaire form. If you're having an injection of X-ray dye, we'll go through the form with you and just to check that you're safe to have the dye. We rarely ask patients to change when they arrive for a CT scan if they come free of metal zips and buckles, but on occasion we will ask you to put a gown on depending on the type of examination that you're having. Ladies who are arriving for a CT scan of their chest, we will ask you to remove your bra unless you're wearing a sports bra.
When I arrived at the scanning room, it was very bright, it was very clean. The radiographer spoke to me about the procedure, what was going to happen.
We'll ask you to lie on the table with either feet first or head first, depending on the type of scan you're having. We'll make you comfortable, and for most scans we'll ask you to raise your arms above your head.
After we had the safety chat and we went through my questionnaire, I was then asked to get onto the scanner. The scanner table is quite low, so I was able to sit down and then I was able to swing my legs onto the table. It was explained to me that I had to have a cannula fitted. It's a bit like someone taking blood from you. It's like an injection into your arm, and it was absolutely fine. You do feel a slight prick of the skin, but it was all okay.
The cannula is a small plastic tube that we insert into the vein in the arm in order for us to administer the X-ray dye during the scan. Contrast medium is a type of dye that we inject into the veins. It highlights blood vessels and organs, and it gives more detail for the radiologist to report your scan. Once we've inserted the cannula, we'll raise the table and bring you closer to the opening of the machine. We'll then connect you up to the X-ray dye. The table, while during the scan, will move you slowly in and out, and we'll be asking you to hold your breath.
I was asked to put my hands behind my head. The scanning table was then moved forward into the scanner, and it then sort of came out again and then it went in again. That's when the radiographer left the room after explaining to me what was going to happen in the scan.
Once we've done the planning scans, we'll then do the main scan, and I'll tell you through the microphone that the injection's about to happen. We'll warn you that when you get the injection of the X-ray dye, you'll get a warm flush through your body, you may get a taste in your mouth, and you'll probably feel as though you're passing water, but you never do. This is just a sensation. I need to leave the room to scan you, but I can see you and speak to you, and you can speak to me at all times.
When the radiographer left the room, the scan started. The radiographer spoke to me and told me to hold my breath, then told me that the contrast was going to go in. This sort of gave me a warm feeling in my body. It sort of maybe had a bit of a funny taste in my mouth as well. It also made me feel like I'd wet myself, but I hadn't, and actually the radiographer had explained that to me beforehand, that I was going to have that feeling, so it was fine.
It's not very noisy in there. It's not like an MRI scanner that bangs a lot. You might hear a whirring of the X-ray tube going around the inside of the scanner, but otherwise there's no other noise. So you can speak to me at any time. If you're worried about anything, you can call out and we'll be able to hear you and we'll come straight in.
You are able to talk to the radiographer during the scan, and you can communicate with them at all times. So the scanning table went in and then out of the scanner a couple of times, and then the radiographer came back in the room.
Once the scan is finished, we'll come straight back into the room and disconnect you from the X-ray dye and bring the table out. We'll then take your cannula out and ask you to wait in our waiting room for 10 minutes.
After the scan, the radiographer came back in the room and I got off the scanner. I had then had my cannula taken out by the radiographer, and I was then advised to go and sit in the waiting area for about 10-15 minutes. I was also advised to drink plenty of water over the next couple of days.
So after the scan, we'll ask you to wait in our waiting room for 10 minutes just to make sure you're feeling okay after the injection, and then you'll be able to go then. We ask you to drink about 1 litre of water for 2 days just to help the dye flush through your kidneys.
At the end of the scan as well, the radiographer advised me when I would get my results. They would come through in about 2 weeks' time.
The CT scanner generates hundreds of images from your appointment. The radiologist needs to look at these images on a specialist monitor and compare those with any previous images in order to issue a report. Your results will be available for your consultant within 10 to 14 working days. If it's the hospital consultant that has referred you, they will contact you, and if it's your GP that's referred you, you will need to ring the GP surgery to make an appointment for the results.
Before the scan, I was feeling quite anxious, I have to say, but after the scan, I am feeling much better, and if I had to come again, I know it would be okay.